See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association, and hosted by nurse economist and health tech specialist, Shauna Butler.
Welcome to See You Now. I'm Shauna Butler. It's great to have you along for another profile in our Moment of Awareness series. Stories of problem finders and solution seekers, of inventors, hackers, wave makers and path breakers, innovators and entrepreneurs. Stories that capture the moments of concern, empathy, outrage, distress, frustration, wonder, triumph, and the journey of problem-solving, invention, trial and error, of convincing, conviction, and creativity. Let's get started. Around the world, cancer is on the rise in people under age 50, an upward march that has been going on for decades. Even with stunning new advances in research, early detection, and treatment, many clinicians are worried about the prevalence of certain cancers, including breast, colon, kidney, liver, and pancreatic cancers in younger people. What's more, practitioners and public health experts are deeply concerned about missed screenings and delayed preventive care as a result of the COVID-19 pandemic and the impact that will have on persistent racial health disparities in cancer care and treatment. In the face of all of this, clinicians, researchers, and community members are working together to find equity-driven, culturally aware approaches that prioritize prevention and accessibility, particularly in communities where cancer hits hardest. In this moment of awareness, nurse practitioner and researcher Timiya Nolan shares the experiences and insights that sparked her commitment to working in and with her community to reduce disparities in cancer care, survivorship, and thrivership.
My name is Timiya Nolan, and I am an assistant professor at The Ohio State University in the College of Nursing, and I'm a nurse. I will be moving to the University of Alabama at Birmingham as the Associate Director for Community Outreach and Engagement at the O'Neill Comprehensive Cancer Center there. My development as a nurse scientist is deeply rooted in my development as an individual. I grew up in a very small town called Brewton, Alabama, and I always say that it's a town where it's one of everything aside from schools. So we have one Walmart, there's one big grocery store that everybody mostly goes to, but there are two schools. And so I went to the county school, which was W.S. Neal. Every morning, go to my grandmother's house. I would watch Scooby-Doo as I waited for the bus, and I would be a part of my grandmother's routine, which was, okay, you wake up, you take your medicine, you eat your breakfast. And that was what she did. I thought it was normal. And growing up, becoming a nurse, then you find out that no, that's not normal and that's not ideal. And so always had wanted to make a difference in people's lives like my grandma. I can't really remember a time when I didn't think about healthcare. I am a first generation college graduate, and I am an individual who identifies as Black. I'm an individual who identifies as a woman, and so marginalized in multiple ways, but then still seeing that there's a light at the end of the tunnel. I went to my first clinical and I absolutely fell in love with nursing because it was there that I saw that nurses were taking care of the patient throughout the day, monitoring, intervening, and ensuring that all of the orders were carried out. Moving into practice, I began in hematology oncology at UAB. I decided on the PhD saying, okay, how can I improve quality of life for individuals who have only a few months or even days or weeks left? What can I do to improve quality of life? That was my first question that I came to Dr. Karen Meneses about at UAB. talking with her, she said, well, breast cancer survivors, they tend to live a lot longer than people who are diagnosed with leukemia. And so you have a lot longer time to be able to think about things like quality of life and how people might begin to use different strategies to improve their outcomes long term. And so working with her and her breast cancer education intervention, I was one of the folks who said, all right, let's take up this mantle. I didn't know what I was getting into at that moment in time. I really didn't. So I had the opportunity to work in her lab, where I was the nurse practitioner who, when survivors called and said, hi, I'm new, I would love to learn about the Young Breast Cancer Survivorship Network, I was that entree. And so I would ask them a series of questions that really understood where they were as a survivor, what their cancer diagnosis was, what their cancer treatment was, what kinds of concerns were still lingering. And we had a monthly support group meeting. What I identified was that there were a lot of women who were young and Black and had breast cancer. And what I did not see at that point in time was that, there's not a whole lot of research that talks about that experience to be young and Black and a breast cancer survivor. And so in talking with these women whom I had met through the Young Breast Cancer Survivorship Network, they were saying that I just don't see me in this survivorship space. I don't see that when I pick up magazines that have information about breast cancer survivorship, I don't see Black women featured. I go to the infusion center and I don't see people who look like me, and people whom I'm sitting beside say, oh, well, I have cancer. Do you have cancer? You're too young. And so that was what I was continually hearing, and that these women, in coming to the Young Breast Cancer Survivorship Network monthly meetings and also the annual meeting, they were finding great collaboration with one another. And so I wanted to know more about these Black women. And in doing the research, I found that Black women who were less than the age of 45 were more likely to be diagnosed with breast cancer. That wasn't the same at that point in time when we looked at the larger cohort of women in 2013. And 2014, it was really more so white women who were being diagnosed. But when we look at that younger demographic, it's Black women. But not only that, Black women were more likely to also die. And even to this day, Black women in comparison to white women are about 40% more likely to die of breast cancer. And so I was like, this is a huge disparity. This is a double disparity because these are Black women, number one, but then they're also young. And so I wanted to understand how I might improve quality of life in young African-American women. And so I used the stepping stone that Dr. Meneses had already created, the breast cancer education intervention. It had had great effect in improving quality of life of older white women. And I said, okay, well, what kinds of things might we need for young Black women? And then what did these Black women say about this breast cancer education intervention? That is the impetus of my scientific journey, taking the baton from Dr. Meneses on the breast cancer intervention, but then seeing how that might translate into a work of love for me to young Black women. That was a beautiful opportunity for me to be on the ground floor of something that was so amazing, and it has just continued to grow and blossom. As I talk to students about nursing and the importance of looking at a patient as a whole person, I really begin to bring it back to their own situations, their own home life. I can't separate who I am, my identity, my upbringing, my training. I can't separate that as I go into these spaces that I'm living and being and trying to make a difference as a nurse scientist. And so I tell them the exact same thing. Remember where you come from. Think about your patient as a family member and how what your family member has been subjected to, what your family member has been born into, how that affects their decisions that they make and the outcomes that happen because of that. Take a good social history. Where do they work? Who lives at home with them? What kinds of finances do they have? Do they live in an area that has low access to healthcare? Do they live in an area that has only one grocery store, but they have to drive 20 minutes to get to that grocery store? And so now you understand who they are as an individual, and we try to meet them where they are. I also expose them to some of our nurse scientists who they're looking at DNA methylation and how that affects the fetus as it grows and what stress is expressed from generation to generation. We also expose them to working in a clinical setting and how they are really helping to develop new information, but also move that information from discovery to implementation at a faster rate. Representation matters. It absolutely matters. Allowing people to see what they can be and see what they can do as a nurse is so important. We make partners everywhere we go. I have great partners who are physicians. Dr. Joshua Joseph, who is an endocrinologist and associate professor here at The Ohio State University. Dr. Daryl Gray, who is a gastroenterologist, and he's actually since left the institution, and he's now the Chief Diversity Officer at Elevance Health. So we got together as folks who had different backgrounds, but had a similar love and want to decrease disparities as we saw them. We started working with this organization called the African American Male Wellness Agency, who does this annual walk every year, and they've been doing it. This is their 20th year. And so they have been doing health screenings at these events. And so we were so fortunate to be able to work with them and to analyze their data for them and to show them that, even though folks are coming out, they know their numbers, the numbers aren't moving. And so because of that, we said, you know what, we got to think about an intervention together. And so what came out of that was Black Impact. 45 minutes of physical activity, 45 minutes of health education over 24 weeks. And so we really worked hand in hand to understand, how do we tailor interventions that we know work, the diabetes prevention program, as well as the American Heart Association's change control program. We know that they work in other populations, but as we looked at participation in past studies, there was an underwhelming response from men who identified as Black. We had to step up that intervention and see ways that we could work together to co-develop. So, it's been a wonderful experience to be a part of Black Impact, because what we learned from them was that, yes, we could improve cardiovascular health, but the secret sauce of how we did that, it's truly community-based participatory research. They talked to us about brotherhood and coming out as an accountability partner to make sure that other individuals were there. They talked about how they had to do this for their families. They talked about the importance of what it meant to have a whole research team behind them that looked like them. They knew I could trust this because I know the African American Male Wellness Agency, and they trust these Black doctors from Ohio State. So this must be okay. And so the complexities of what it takes for us to move and be in this world and think about how we are able to move from research to implementation in everyday practice, it's representation. It is seeing and building relationships that will help us to move things forward. Every individual, from the African American Male Wellness Agency to the Ohio State University to American Heart Association within our Columbus region to American Cancer Society, even Ohio Health, the list goes on and on and on of our partners that said, okay, here is a demographic, Black men, that we need to wrap our arms around them to help them to increase their cardiovascular health. Because we know if we do that, we will have fathers longer, we will have uncles longer, we will have friends longer, and we know that we will have the chance of better health for all in our families if we can change the life of one. Who would have thought that I would have these experiences, that I would actually become a nurse and then a nurse practitioner, then a nurse scientist, and now even moving into an even bigger role where I'll be the Associate Director for Community Outreach and Engagement at the University of Alabama, Birmingham, with the opportunity to create a vision to improve cancer control throughout Alabama. It's absolutely mind-blowing to me.
Nurse practitioner and researcher Timiya Nolan is enthusiastically focused on the multiple disparities of cancer care and outcomes for her community, and doing so by remembering and cherishing where she came from and treating everyone like family. There is growing evidence of cancer disparities in the lives of the Black community. Research indicates that these disparities are driven by a combination of inequities in health coverage and access to care, social and economic factors, and research and treatment that are rooted in racially driven discrimination. Reducing gaps in health insurance, addressing food deserts and toxic environmental exposures in Black neighborhoods, increasing diversity in cancer clinical trials and in our healthcare workforce can ensure that advancements in cancer treatment benefit all groups. As Timiya's leadership highlights, working together in our communities is the path towards health equity in cancer. You can find more information and links in our show notes at seeyounowpodcast.com, where you can check out our entire See You Now library of award-winning episodes. For See You Now, I'm Shauna Butler. Thanks for listening.
Nurses are transforming healthcare through innovation, compassion, and leadership. And Johnson & Johnson is proud to continue its 125-year commitment to champion nurses through recognition, skill building, leadership development, and more. The American Nurses Association is dedicated to building a culture of innovation. Nurses improve the lives of patients and communities through innovative thinking, empathetic connection, scientific rigor, and sheer determination. ANA is proud to support and advocate for our nation's most valuable healthcare resource, our nurses. For more information on See You Now and to listen to any of the earlier episodes in our library, visit seeyounowpodcast.com.